Living with trauma or with certain medical illnesses can feel like living in chaos. Things can feel unpredictable and uncertain, overwhelming at times. It might be hard to feel a sense of stability and predictability. If we want to regulate our emotions, often this takes conscious effort, including using our thinking skills. But what about when we can't make that effort, when we don't have access to good thinking skills? Something that can be really helpful for trauma survivors, or really anyone, is to learn how to ground and orient. Grounding and orienting refers to simple strategies we can use to bring a sense of balance back to our nervous system. These are deceptively simple strategies but can have a big impact. Even children can use them and find them effective. Simply put, when we're overwhelmed with our experience and things are feeling chaotic, we're not in the present moment. We might be overwhelmed with fearful thoughts about the future or overloaded with sensations in our body. Grounding and orienting are ways to bring us safely back to the present moment and back into our body in a way that feels safe enough. When people have suffered significant trauma, they may be prone to flashbacks and dissociation. What we need is to be able to bring people safely back to the present moment in contact with their five senses and their body. There are two ways to think about grounding and orienting: how you are when you're interacting with patients, and also skills that you can teach patients to use on their own if they're open to it. Let's talk about these separately. So let's talk about grounding and orienting in a session with your patient. First, let's talk about grounding. And this is about simply being with your patient with an emphasis on the being with. So you can think about the charge of trauma as akin to a current of electricity. Electricity needs a ground or it can cause harm. In this scenario, you, specifically your connected presence with your patient, is the grounding here. If you notice your patient seems to be in a state of distress when you're with them, that is first and foremost a cue for you to ground in your own body as a way to help bring them back to the present moment. For example, you might feel your feet on the floor, your back against the chair. Take some nice, full, deep breaths. Whatever strategies that you have that are effective to help you feel connected to your senses and to your body in the present moment. Anything that brings you back and helps you to ground will actually cue your patient's nervous system that it's okay to be here in the present moment. Now, why is that? Well, when a patient is in distress and they've gone away in their mind, in other words, they're experiencing a flashback or dissociation, we want to help them re-regulate their nervous system. And when people have difficulty with self-regulation, we can help them through co-regulation. So this is why we say that the first step for you as a provider is to actually regulate your own nervous system, and immediately that will begin to cue your patient, oh, here's an opportunity for co-regulation. And then they will be more receptive to cues for self-regulation. So, as a next step, you might actually invite your patient to join you in grounding, perhaps offering something like the following prompts. I'm picking up on that you might be in some distress right now. Am I noticing that correctly? I'm wondering if it would be okay if we could explore some quick and easy things in this moment that might be helpful to you. First of all, I want to check, is there anything that you do already that helps you when you're in a state of distress? Would it be helpful for you to do that right now, or for us to even do it together? If your patient already has something, like a breathing technique, It's helpful just to offer some space for them to do it. Or if they're willing, you can do it with them. Again, with this idea that you are facilitating conditions for co regulation. Sometimes, even just noticing your patient's distress and cueing them to use whatever tools they already have can be helpful. If your patient doesn't have any tools already, then you could offer something like the following. I'm wondering if it would be okay if I offered you something that might help. There's something called grounding. Have you heard of that? When we get activated with trauma symptoms, sometimes we go away in our mind for a moment in time. The purpose of grounding is to bring us gently back to the present moment, into our body, using our 5 senses. Would you be willing to try that with me? Okay, great. So let's feel our feet on the floor. Noticing perhaps how your feet feel inside your shoes and then on the ground under you. What do you notice? And make sure you pause here long enough for your patient to perceive what's going on. Remembering that if they have gone away in their mind, they're probably not going to be able to answer your questions immediately. So when we give a prompt, we want to leave enough space and time for them to actually ascertain what they're experiencing. So next you might inquire, let's maybe notice our breath. Not changing our breath in any way at first, just noticing what our breath is like. Where are you feeling it in your body? Again, pausing and allowing space and time for your patient to actually ascertain what's going on. Next, you could invite them. Perhaps we could try something called square breathing. This is a type of breathing where we inhale for 4 seconds, hold for 4 seconds, exhale for 4 seconds, and hold for 4 seconds. Would you be willing to try that together? Of course, each time we are using invitational language and we're giving our patient an opportunity to affirmatively consent or decline. Part of their experience of dissociation may be because they perceive they are not in control of the situation. So, another way that we actually ground people and bring them back is to offer them choices. After grounding, then you could try orienting together. Orienting simply means being rooted in the here and now of things using the 5 senses. You could offer the following prompts. Sometimes when we get really overwhelmed, we go away in our mind. I'm wondering how you would feel about us coming back to the present moment together. Specifically, I'm wondering how you would feel about taking a look around this room and finding something that looks interesting or enjoyable or peaceful or even just neutral. Somewhere you could park your attention, even if just for a moment. And make sure, again, to pause long enough that your patient actually has time to ascertain where they are. Even before they have found the thing they want to focus on, just looking around the room and seeing what's there, they're already beginning the orienting process. When they found something, next you can say, great, you have found something. Tell me what you notice about it. Tell me in detail. Really pay attention to the details, the textures, the way it looks, anything else that stands out. What draws you to it? Hopefully, what will happen is after this brief conversation, you can check in with your patient and already they're feeling a bit more connected to the present moment. Notice how you observe their level of present moment awareness and what they report about how they're feeling. If helpful, you could use something called the SUDS scale, which stands for Subjective Units of Distress, where you ask them to rate their current distress from 0 to 10, where 0 is no distress and 10 is the worst they could ever imagine feeling. If they're still at a 4 and above, try going through another round of grounding and orienting if you have time. If you don't have time, this might be a good opportunity to introduce container, which we discuss in a separate video. Now let's talk about giving your patient grounding and orienting strategies to practice at home. These are quick and easy tools that will help patients build their self-regulation capacity if used regularly. As always, begin with informed consent, such as the following. Being overwhelmed and going away in our mind is quite a common experience after significant trauma. When that happens, it's your body and brain trying to protect you from the pain and suffering. However, we don't want to do that all the time because it might mean we miss important things that are happening that we need to be present for. I'm wondering, what have you found helpful to calm yourself and bring yourself back to the present moment when you go away in your mind? If the person has strategies, then encourage them to use them. If not, then this is an opportunity to offer them to them. Would it be okay if I shared some options with you? When you get overwhelmed, first, it can be helpful to just orient to your surroundings as a way to get back into the present moment. Some people like to use what's called the 5, 4, 3, 2, 1 method. That means we name 5 things you can see, 4 things you can feel, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. If that seems too complicated or hard to remember, you can also just do it the way that we did today in session, where you look around your environment and try to focus in on something that feels interesting or safe or peaceful or even neutral. Orienting can be really helpful when we're out and about and need something quick to use. The other thing we can do is grounding. Again, if you're out and about or with other people, a basic way to ground is simply to feel your feet on the floor, whatever surface your back is against, and take some nice full breaths. And with each breath, just letting go of whatever tension is in your body, feeling yourself more connected to the ground and your surroundings. When we ground, it's like we're taking the electrical charge out of our nervous system. If you're at home, there's other ways you can practice grounding. It's basically any way to engage your 5 senses. So for example, you could say out loud what the day, date, and time is and your full name, and that you are here and okay in this moment. You could suck on an ice cube or put your hands under the cold water and rub them together, saying, "These are my hands. I can feel my hands right now." You could eat something sour or tangy or spicy, like citrus fruit or a spicy candy. You could pick something in your environment and describe it in as specific as detail as possible. You could smell something pleasant in your home, whether it be bath salts or essential oils or flowers. You could change your environment, get outside, go for a short walk, touch the grass, or feel the bark of a tree. You could look at a picture of a place or a special person that makes you feel calm and safe or happy. These are just a few examples, but you get the general idea. Basically, anything to get you into one or more of your 5 senses. In conclusion, Flashbacks and dissociation are common symptoms of trauma and can create overwhelm and distress for our patients. By practicing grounding and orienting with them, as well as teaching them to practice on their own, these are simple yet effective tools that can start to cue your patient that it's safe to come back to the present moment and that actually they have the capacity to purposefully choose to do so.